My name is Dr. Joshua Dunsky, Clinic Director here at Dunsky Rehab and Spine Center and Exclusive Nerve and Disc Centers. Today I want to tell you about a patient who came in. He's 24 years old, significant neck pain, radicular symptoms down his right trap into his right arm, conservative care for about 6 months, didn't give him much relief. If he did have some, it was pretty much temporary from conservative chiropractic care, physical therapy. He's also had 3 rounds of injections. What we see on the MR over here is we see the cervical spine. You can clearly see some disc desiccation at the 2, 3, 4, 5, C5, C6 disc. He's got an extrusion at that level. He's also has some ventral sac, fecal sac impression. No apparent cord deformity at this point, but he's got some pretty significant intrusive indentation of that fecal sac, some anterior spurs. During the coronal visual evaluation, he's got a herniation of that level as well. Because there's a pumping mechanism at every level in the spine, from C2 down to the tailbone, at every level of the discs, there's a pumping mechanism. That pumping mechanism can fail. He's an athlete, been hit several times, football, lacrosse, just being a kid as well, and that pumping mechanism has failed. When that pumping mechanism fails at the disc dries out. And one of the functions of the disc is to protect the nerve. If you leave a sponge out on the windowsill in the middle of August and the sun dries up that sponge, you can literally take a sponge and crack it in half. Well, this gentleman happens to have tears at the lateral quadrant of the disc and also centrally, which allows the nucleus, this very viscous, strong material inside the disc, to literally rupture through the weakest parts of the disc, much like a jelly donut. So if you squeeze a jelly donut, that jelly comes out. It's exactly what's happened at that C5, C6 area. Not only that, he's got degenerative disc disease because that disc is collapsing, and he's got compression of the nerves that live in this home called the IVF. He's in rough shape. He's starting to have weakness, atrophy of the muscles of the right upper extremity, numbness and tingling, of course, and then pain into the trap, into the right upper extremity as well. So we put him on a protocol, a nutritional protocol. He's going to be utilizing our Class 4 and then our Class 3 laser. We have an M6 robotic Class 4 laser. He's going to be put through the Hakamed electromedicine, which is a form of electrotherapy, and then non-surgical disc restoration to help reestablish the pump and also open up the facets, which I failed to mention. The facets are the hinges in the spine, which are now literally closing in on each other, causing a lot of wear and tear and a whole other slew of symptoms from that. So that's his protocol, and we'll report back in about 3 or 4 months, and we'll update you on how he's doing. Take care.